Hi, Dr. Ace Thayer here, Balanced Focused Neck Adjustments. This is part 2 you're going to see today. I hope you guys watched part 1. If you haven't, go back and take a look at it because it's really great change. This is part 2. This is going to be your 3rd through 6th visit. I think you'll like it. You're going to see how Maria has unbelievable change and how she gets her life back. She really is stoked about this. We're also going to learn how a purse can give you a headache. And so you guys will learn a little bit about that too. And then journaling, how journaling is important to find clues how to fix the patient. So watch all of that information. I hope you like it. Remember, if you like this information and you want it sent directly to you, like and subscribe. We'll send it right to you. Thanks for watching. Love you guys. Okay, second day. This will be her 3rd adjustment, right?
Yes.
3rd adjustment. She's had 2 under her belt, and she had her first night's sleep. So I'm going to let her talk and let her tell us what happened. We just had some wonderful results, and I want to get that captured. We'll get her adjustment and go on. So tell us exactly what you just told me a few minutes ago.
Since my last adjustment here yesterday, I felt overall better. Went home and did completely feel more restful and relaxed towards the evening when I went to bed, and I really had a good solid rest. Haven't had that in a while.
How long? Years, months?
Years.
Years.
Since, yeah.
Now, people don't believe you out there. They're
Yeah.
gonna be like, oh, he just thinks, you know, he's convincing you you're going to sleep well. He told you to sleep well.
No. I've been going through a lot of pain, excruciating pain. I've been going through surgeries, through epidural injections since 2016 in May. And this kind of adjustment, it's really been helping me a lot. And this is just only my 2nd day. I was able to wake up this morning and I'm like, okay, I'm not stiff. I feel fine. I'm able to just. It was hard for me to just wake up and just get out of bed.
Because why?
Because of my joint pain.
Oh, before?
Yeah,
I thought you were going to say hard to get up because you wanted to
before.
sleep more.
No, but because I was so restful sleeping throughout the night, I was just able to just wake myself up and not think about the pain. It's simple as that.
Is that funny how much that bothers your brain?
Yeah, it takes a lot of energy out of you.
Yeah,
when you're
but
constantly thinking.
You're constantly thinking of pain.
Right.
And to actually have a break from that. Tell me, you woke up last night, why? Not because of pain, because of why?
Oh, I had a cramp
Sorry,
on
husband.
my feet. I had a cramp on my feet. I mean, it's not as bad as what I've been going through. But that's nothing compared to my...
Now I'm talking about the husband.
Oh, yeah. Yeah. It's not the pain that woke me up, my husband snoring.
I love that. She's like, I haven't even heard him snore in a long time, but last night I was like, I heard him snore.
Yeah. It was not the pain.
It wasn't the pain. I thought that was funny.
Yeah.
Okay, so definitely you had the foot pain. You still woke up a couple times. You had pain this morning on the drive here. Again, not out of the woods. You still have pain, right?
Right.
But overall experience, you feel like you're moving forward, right?
Yes. Yeah, I feel like I'm getting my life back. Honestly, I really do.
That's awesome. I love that. Thank you for saying that. So she did really good. We take notes, journaling notes. A lot of my patients don't listen to me, but she did, and she did really good. She told me what was going on, so I love that she did that. She did her walk, she did her ice, and tell us about the ice. I want to hear this real quick.
Yeah, I had some pain going on my neck last night before going to sleep, but I remembered that icing is good, and I
The doctor told you to ice?
Yes, doctor told me to ice.
And I wanted you to tell me what was the result of that ice, because you hadn't done that before, so tell me.
I felt a lot of pain on my neck, but there's something about the ice that really helps. Yeah. It just kind of relaxes, eases the tension, I guess, and the nerves that I've got going on.
But you hadn't felt that result. You hadn't done that before.
No.
Yeah, right?
No.
And your whole body felt different because of the ice.
Right.
And so all you guys can ice at home too. It's not, that's free advice. Ice is unbelievable modality when done correctly. Ice your neck, people. But she came to me, she goes, you told me to ice, and I iced, and it was getting pain, and she goes, the pain went away.
Yeah.
With the ice. So it's not always going to happen perfectly like that.
Right.
The adjustment and the ice together work better, but she had that result, and I always call those home runs. She had a home run. I gave her some advice, she did it, home run. So guess what? She's going to do it again in the future. You're going to be like, I don't know, that Dr. Thayer told me ice a couple years ago. I think I'm going to pull that ice out again because it always feels good. And that's important because ice is always beneficial. Okay, you mean she might talk like that. That's me talking like her if she talked like me in the future. Okay, so let's get you adjusted again. I want you again, rewind back to the first day. I want you to see how she talked. She's talking faster, more articulate. I want you to, again, last night her eyes were better. Look at her eyes today, and look at her posture, look at her body language. One day, and you can see the sureness in her stance. She's not swaying like she was the first day. She's sure-footed, and so all those things are benefits of balancing the body. Not just sleep, not just trying to remove pain. It's about balancing the body. Her body is better, and you can actually physically see it. And she's smiling. There you go. Now you're backwards. I like those shoes, man. Check out those shoes on the camera. Look at those suckers. See, would you have worn those yesterday?
No, I was wearing boots yesterday.
Yeah, wearing boots yesterday.
It was a little colder yesterday.
Yeah. No, I'm talking about just they look like they're a little less balanced. They look like, oh, I gotta walk in them. Good. So how does this feel today?
It's right now that where you're touching it hurts.
It hurts.
Hurting, yeah.
Gotcha. So again, you feel better today, but you can see how the body is going backwards a little bit. We're going to talk about muscle memory in the future when we go over X-rays, and we'll talk about the importance of training your body to be better.
Okay.
Good. There you go. Good relaxation. Good, good, good. You guys should all take note. This is what relaxing on my table looks like. She's done a wonderful job, and it's only going to benefit her. Right there. Good, nice. You feel how that feels compared to last night? A little smoother, a little easier. You can feel how your even jaw moves a little bit. Good, perfect. The combination of sleep, relaxation, trust goes a long ways. Beautiful. Okay. How about this pressure where I'm putting again?
It's less.
Fingers. It's less again, right?
Yeah.
Yeah. She has a tremendous amount of pressure under her skull. The suboccipital muscles are spasming. They always spasm with patients like her. So after I adjust her, the muscles immediately relax, and she feels that. So a minute ago it was tender. Now it feels good almost a little bit. Good. Okay, guys. So that's her third adjustment. I'll let you guys keep watching. See you guys next time. Dr. Thayer here. Maria, this is going to be her fourth visit. She just got adjusted an hour ago, 2 hours ago, maybe an hour and a half ago. She had wonderful results. You just saw the previous video. What happened in this last hour?
I developed a mild headache while I was walking. It was mild.
Okay. How fast did that mild headache come on?
What do you mean, how fast?
Well, I adjusted you. What happened? You walked around the building like I instructed you to do. And where did you start to have the headache? In the walk, right?
Yeah, in the walk.
Gotcha. About 15 minutes after I adjusted you.
Yeah.
So 15 minutes, guys. This is called muscle memory, and so I'm not scared of symptoms coming back. We call it regression. Your body's kind of unwinding stuff, but I'm not scared of her having a step back. And the reason for this is because the step back is going to teach us what's going on. So tell us, last night you walked around the building 3 times, like I told you, right? How'd you feel last night when you walked around the building?
Better.
Gotcha.
Better.
And so this time you walked around the building, what was different? What did we learn that was different?
The mild headache.
No, what did you do differently?
I was carrying my purse.
And you didn't carry last night, right?
Right, yes, right.
So show us how you put it on your shoulder. So she walked around the building like this. You don't have to accessorize it. So, anyways, Difference is that even a purse carried incorrectly caused muscle tension. That muscle tension threw her out a little faster than she did last night. Because last night she had hours. She drove home, walked around the block, no pain. This time, 15 minutes of pain. So what you do does unwind what we do here. Okay. So carrying the purse on one shoulder, bad. If she wore it as a backpack, better, because we want to balance the body. And by carrying on one shoulder, she lifts her shoulder like this and walks around cute, you know, and shows everybody her nice cute purse. But the problem is that it creates tension in her neck, which throws you back out of alignment, which is muscle memory, which we'll get into more in the future again with you, okay? Good. So anything else you want to add?
No.
Good. Oh, the breathing. Tell the breathing too.
Oh, yeah, the breathing did help me. It's reminding me to breathe more.
No. But she got the neck, she got the headache a little bit, and then she had to like concentrate on breathing again a little bit.
Yes, because when pain triggers, you get to breathe.
Gotcha. So, anyways, we're gonna adjust her, and her breathing's gonna be better again. Okay. So go and lay down, please. Feel the pressure right where I'm pushing, right? And it's almost into your head too now, right?
Yes.
Okay, so that wearing that purse caused these muscles to tighten up into your neck, which caused this to activate, which again threw off your breathing rhythm. Good. I was a little tighter than this morning, huh? Yeah. So that tension that builds up because of what you do makes it easier or harder for me to help you?
Harder.
No, today it was harder,
Oh,
yes,
hard,
but
yeah.
yes, but sometimes it can make it easier. So we're going to learn about all that stuff as we go forward, okay? Good. So, after we're done with this adjustment, we're going to sit her up and then finish the video, okay? Good. Good. There you go. Much better. Okay. I'll put pressure up here again. Less again, right?
Yeah.
And the head, the pressure in the head feels
Less.
tiny bit less, huh?
Yes.
Yeah. So I'm going to sit you up in a second, just like we did last time. You're not going to walk down the hall. We're just going to sit you up, and I want you to tell me how you're breathing when you sit up. Okay. Good. Get comfortable in the chair. So tell us the two things that you came in with just now after the morning adjustment was the head pressure.
Head pressure. Head pressure.
And so how's that?
Okay.
And the breathing, how's that? Any change? Truthfully, I don't want you to sugarcoat anything. If it's the same, it's the same. If it's better, it's better.
I'm feeling less pressure on my head. The
Good.
headache is less right now.
And how's the breathing? Still difficult? Still tight?
No, it's deeper now.
A little deeper. Gotcha. Okay, so again, I'm not trying to force her to tell me what I want to hear. It's that it actually, when you throw yourself back out of alignment, muscle memory kicks in, bringing all the old symptoms back. Okay, and so when you do another adjustment, it clears that up. So we need to train her how to avoid those things. So we're training you how to carry a purse, and that'll help you a lot better. And we'll just keep peeling away these things. Okay. So see you guys next time. Hi, just a quick catch up with Maria. She is on her 1, 2, 3, this will be our 6th visit, I guess?
Yes.
6th visit in less than 5 days. And she's done remarkably well. She's also has some pitfalls and some stumbles along the way, but she's going to tell you overall how she feels, and she's also going to tell you when she's still hurting. She's going to be totally honest with you about how this is all going. She told her husband this morning, how's it going? Her response is perfect. perfect example of how somebody is at this point in the treatment. So, Maria, how are you doing right now? How are you doing overall first?
Overall, since I started, I've been feeling a lot of improvement this week. I'm surprised in how I've been able to just sleep better. First of all, to me, that's a big plus. It means a lot. Mm-hmm. Just being able to just sleep without any pain.
Yeah.
Without any pain, and I've been able to stand a lot more.
Okay, so she's having problems standing. She's going to tell you she has pain and all these kind of things. But overall, you said, how long could you stand before? That's what I was curious about. That's what I wanted them to know.
Mm-hmm. How long?
You said in the kitchen, you said, I could only stand for how long until the pain was so excruciating.
Right.
What happened?
Before it was like just 15 minutes.
15 minutes, and it was so bad you had to go sit down, right?
Right.
Now, how long can you stand in the kitchen? Or stand?
More than that. 30 minutes, 45 minutes.
45 minutes. There's not even a time limit now, right?
No,
you just
I
go.
Forget.
You just forget, right?
Because I'm so busy now doing what I've been wanting to.
So the two things that she told me this morning, she told me, oh, this hurts, this hurts, this hurts, this, and I go, Maria, how you doing overall? She said, I'm sleeping, and I can stand longer, even though there's pain. I can stand longer,
right.
And that was two big things for her, 2 home runs for her.
Yeah.
Okay, and so what'd you tell your husband this morning when he goes, how are you doing? What's going on? You wasting our money down there? What'd you tell him?
I'm telling him I was just feeling much better.
Good, perfect.
Better, yeah.
And so now, let's get into the nitty gritty. She did some journaling for me. We do lots of journaling. You don't have to read all this stuff, but did some journaling. So she has a lot of different issues, a lot of things, and they're all pointing back to poor posture. Sitting, standing in the kitchen, doing laundry, reading, all that stuff's hurting her. Sleeping, all the stuff. She's like, I have pain this, I have pain here, my hair, la 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 la, right? And she gave me a whole laundry list of stuff. And so I go, stop. Let's just find out how you're doing. So she's doing better, but all these things are clues to how she's messing up, how she's unwinding the problem, okay? And so that's important. And so we're going to get into the nitty-gritty as we move forward, but this is 6th visit. She's doing great. Tell us about the walk around the block.
After my adjustment earlier, I did my 3 walks around the block, and I did feel some headaches, some tension, my head, my shoulders.
Yeah, you felt great this morning after I adjusted you, right away on the walk.
Right.
And what did I tell you about the walk? Why is that important?
Because I got to keep my posture.
Posture's better, right? Head up, look straight ahead, right? Gotcha. Yeah. And so we have to unlearn bad habits. So that's what we're doing right now. Again, watch you just see where she's at. Good start. She's happy to be here, happy to make the drive, but we have lots to still work on. So I'm glad you guys are watching. So let's get you adjusted, kid. Glasses off. I don't want you to pull those. Good. We also noticed that she was tighter this morning too, on her adjustment. For some reason, new positions that she's in, the new balance is causing her to sleep differently, to move differently, so her body's tighter in different ways. Good. She was a little easier than this morning. Yeah, a little easier. Still tight. Doing good. And we're still doing mid-cervical, guys. We haven't even gone to Atlas. We haven't done upper neck, nothing. No lower neck, just mid-cervical adjustments here. Nice and conservative stuff. Good. What does that feel like, Maria?
Doesn't hurt as bad.
This morning was worse, right?
Yes, it was.
Yes, exactly.
Yes.
So, good adjustment. How's your head feel after that adjustment?
Just now?
Yeah.
I don't feel it.
The headache's a little different?
Yeah.
Gotcha. So, anyways, that's where we are right now. 6th visit. Thanks for watching. See you next time.